All right, good afternoon, everyone. Mark Slater here with Prime Spine Consulting. Welcome to today's live Q&A in the Personal Injury Accelerator program. Today, I'm lucky to have with me Dr. Steve Barnett. Dr. Steve Barnett, I've known Steve for many years, probably over 10 years as a practicing personal injury doctor here in the Atlanta market. Steve's been a chiropractor for over 47 years, had an active practice for 30 years here in Atlanta, and really built his practice by marketing to the medical community. Steve was also hired to be Director of Chiropractic Relations for Emory Decatur Hospital here in Atlanta. He worked in the hospital because they saw the value of working with chiropractors in the Emory Hospital. And I've invited Steve here today to share his knowledge. Well, Steve also became certified to do life care plans. And that's going to be the focus of our discussion today. Like, what is a life care plan? How does it benefit you, the doctor? How does it benefit the attorney? And of course, how does it benefit your personal injury patient after your care is done? So, Steve, welcome to the interview. Thank you so much for doing this for me. And what's a life care plan?
Well, first, thank you for the invitation, Mark, and may I congratulate you on your choice of shirt color.
Thank you. I've got good taste. Yes.
You got the memo, obviously. So I think we're going to probably talk about a lot of things within the next 30 minutes, and life care plan being one of those. So what is a life care plan? Most attorneys know what a life care plan is. A life care plan is a dynamic document that evaluates a patient for injuries and then determines what the pattern and pace of those injuries will predict as far as future medical care and cost. So you know, as a chiropractor, you're going to deal with your patient. You're very good at what you do. You're going to help that patient get better, but how old is the patient and how much care is that patient going to need throughout his life expectancy? And the charts that we use are the CDC's vital statistics chart to determine what the patient's life expectancy is and what their care and the cost of that care is going to look at in today's dollars. So attorneys like to use a life care plan in specific cases when they feel that it applies, if they feel that it's going to increase the value of the case. So as a life care planner, I review thousands and thousands of medical records. So what an attorney wants, if you're going to do personal injury work, it's like anything else in your life, you have to do it well. So I'm sure clinically, every one of you who are on this podcast are very proficient. I've lectured to hundreds of chiropractors in hundreds of places. And in every room that I've been in, the chiropractor looks to the left and the right and thinks he's sitting next to the second best chiropractor in the room. So we'll just assume that everybody is great at what they do, but is everybody great at keeping records? So you take the care of the patient, and if you're going to do personal injury work, then co-managing your cases with medical providers, imaging centers, hospitals, psychologists, psychiatrists, neuropsychologists become extremely important, because I'm proud to be a chiropractor, but chiropractic does not drive the value in these personal injury cases. So what makes you valuable to a personal injury attorney? First of all, referrals, obviously. If you've got unattached cases to give, you can become popular with any personal injury attorney in the civilized world. But if you don't have a lot of cases to give, then what makes you better from the chiropractor down the street? Your treatment, of course, patient outcomes are very important, but how you co-manage your cases with medical providers and how your notes look at the end. So Mark and I were having a conversation before we actually got on this podcast, and we talked about one of my pet phrases, which is MMI, maximum medical improvement, which is an acronym that I hate because it really doesn't apply in personal injury cases. Now,
Where did that come from? MMI, who created that?
It's created by the insurance industry. So if you tell, a story long enough, you believe that it's true. These patients really never reach maximum medical improvement. For those of you on the podcast who have been to a dentist, when was the last time your dentist ever said, Harry, you're doing great, you've reached maximum dental improvement, you don't even have to come back? Well, if you have a dentist like that, give me his telephone number, because that's the guy that I want to see. When I'm in the dentist chair, before I get up, I have a card with my next appointment. And as a chiropractor, you have patients who complete your recommended course of treatment, whether it's 2 or 3 months following an MVC. And then how do you end it? What do you say to a patient? You've reached maximum medical improvement. You've reached maximum chiropractic improvement. That's not the way you want to phrase it, because as a life care planner, what I'm trying to do is evaluate what care that patient is going to need for the rest of their life. So if they're 26 years old and you tell me they've reached maximum medical improvement, MMI, am I supposed to believe that that patient will not need chiropractic care for the rest of his life at the age of 26? And if that patient has an exacerbation in 2 weeks or a week and schedules to make another appointment, how are you going to answer that question if you're deposed? Well, Dr. Jones, you said Mr. Smith received maximum medical improvement a week ago, and then he's back. So it must not be because of the accident that he was in. He must have had a new injury or a new condition. It creates a speed bump and a question that you don't have to answer. So how do you discharge those patients? How do you slide into a period of corrective care? So instead of saying Mr. Jones reached maximum medical improvement, you could say Mr. Jones seems to be fairly stable. At this point, we have given Mr. Jones a home exercise program to do. We expect exacerbations in the future, and we've advised our patient if any new symptoms erupt or any exacerbations of those symptoms come about, please contact our office immediately. It leaves the door open. You don't say he's reached maximum medical improvement. You've left the door open for exacerbations and new conditions. So when the patient comes back and says, I sneezed, and now my back feels as bad as it ever did. So then you can institute care and go from there. Or if you want to help a life care planner, you can say at this point, he appears to be relatively stable. We've given Mr. Jones a HEP, a home exercise program, in order to encourage muscular strength and re-education. We've advised him to contact our office if any new symptoms develop or exacerbations of the old ones. And at this point, I've told Mr. Jones that I'm recommending 2 chiropractic visits a month or a chiropractic visit a quarter throughout his life expectancy. That visit will include electric muscle stim, ultrasound, soft tissue traction, careful spinal manipulative therapy, and ice and heat. And the approximate cost of this visit is $450. So as a life care planner, he said, okay, well, Mr. Jones is 26 years old. He's predicting that he needs to come in 4 times a year. 450 times 4 is $1,800. So it's $1,800 in chiropractic care a year. He's 26 years old and his life expectancy is 84. So we expect that this number is going to reflect the true cost of his chiropractic expenses in today's dollars throughout his life expectancy. That is what helps you as a chiropractor establish a relationship with an attorney, because you are helping him by providing your medical records an insight as to what that patient is going to need in the future. And I can tell you, as a life care planner, I examine a lot of research articles. So if you believe in physics, and I believe in physics, energy is never lost. Energy is transferred and absorbed. And if you read the research on facet injuries and capsular ligaments, you would realize that those capsular ligaments never fully heal. Those facets are at risk forever. So that's why we manage pain with pain providers. As a chiropractor, I did a good job. My patients got better, but I didn't check on them until their life expectancy. Okay, I was there for 30 years and we saw a lot of repeats, as you do, over a period of time. But facet injuries are like bad relatives, they can be forever. So what do you do? If you're not co-managing your patients with medical providers and diagnostic imaging, I don't think there's an attorney on the planet that's going to want to use you as part of his client's care. It's not chiropractic that drives these settlement outcomes. it's pain providers. When patients are on the pain train, as I call it, and they get facet injections, if you read the statistics or talk to any pain provider, those injections are temporary, they're there for pain. It's recommended that the patient come in twice a year for the injections, RFAs and medial branch blocks every 9 to 12 months. Other procedures that are there that chiropractors don't have to worry about are basilar vertebral ablations, which is for axial back pain. Those studies, if you look at them, those patients are seen every 5 years. Artificial discs statistically only have 10 years worth of data. They need to be revised, replaced, or extended after 10 years. Those are the kind of things we look at as a life care planner to determine what care and cost that patient's going to need forever. So as a chiropractor, and I know that's why I'm here, because I speak to you today as a chiropractor, a hospital administrator, a certified brain injury specialist, a certified life care planner, and a consultant to neurosurgeons all over Atlanta and, in the Southeast. I deal with them every day to try to help them with their medical records and how to relate and send patients back. You as a chiropractor, if you're co-managing your case in personal injury or in commercial medicine, which means you're filing, Blue Cross Blue Shield or United Healthcare or any one of the many insurance companies, they look at you and they determine what usual and reasonable customary is for chiropractic. We know if we get a patient in there with a disc injury, they may be coming for weeks to months. So how do you secure the fact that you're going to get paid? Because you receive an EOB stating that you've exceeded URC and 6 visits is what's allowed and that's all we're going to pay for. Well, if you have a note in your file from Dr. Smith, the pain management physician, we've given Mr. Jones, the patient, injections. We've advised Mr. Jones to return to Dr. Slater for continued chiropractic management for 4 to 6 weeks. All of a sudden, in your records, you have a note from a medical provider giving you a prescription or a script for chiropractic care for 4 to 6 weeks. And you should follow that. You're getting an additional 4 to 6 weeks of visits in simply because you co-managed your case with a medical provider. Now, if you get deposed in the personal injury space, they might say, Dr. Slater, why did you have to see that patient 35 times? I mean, that is way out of the box. You should have been able to get that patient better in 16 visits. Well,
which they pick out of thin air.
Yeah, which they might pick out of thin air. But, well, yeah, that's a good question. I have a letter here. I referred Mrs. Jones to Dr. Slater on 6/14/2021. And, Dr. Slater said in his records, he gave an injection, facet injection in C4 and C5 to the patient, and he recommended 4 to 6 weeks of continued chiropractic management. That's why I saw the patient another 9 times, because it was recommended by her medical provider.
Steve, I have a question. So who orders a life care plan? I know a chiropractor has awareness of this and he can share this awareness with an attorney, but what's the workflow of how you get a life care plan started and how do you introduce that concept to the attorney?
Well, I've spoken to many attorneys at various functions, and some of the biggest attorney practices in the United States, certainly the biggest here in Atlanta. Most attorneys think that a life care plan is used for catastrophic injuries, and it is. If somebody, God forbid, has lost a limb or any of his senses, or he's a burn victim, or there's a head injury, they understand that they might order a life care plan for that. But what the attorney. But what they don't realize is chronic pain is a chronic injury. So there's more money spent on the treatment of chronic pain in the United States than there is on any other disease. $600 billion a year is spent on the treatment of chronic pain and the lost hours from work due to chronic pain. Patients that have nociceptive pain or neuropathic pain, they don't get better necessarily. In our world, injection therapy, and physical therapy, even chiropractic therapy, is classified as a postponement therapy for patients that need surgery. So because I work with neurosurgeons every day and I was involved at the hospital with the neurosurgical service line, we take a look at that and say, okay, well, we've got a patient who's 26 years old. We don't want to do a fusion on this patient. We know that this patient needs spine surgery. So what are we going to do to prevent that patient from having spine surgery and a fusion at 26? We're going to do everything that we can. We're going to do chiropractic care. We're going to do physical therapy. We'll inject him 2 to 3 times a year. We'll give him medication. We'll change his job restrictions. And we don't want him to have a fusion until he's in his mid-50s. Why? Because he'll develop adjacent level disease. Okay, and he statistically, if you do the research, he's going to need an extension or a revision in 10 years. 36.1% of all patients who've had a 1-level fusion, if the rest of their spine is in good health, are going to need an extension or revision within 10 years. Disc replacements, artificial disc replacement surgery. There's only 10 years worth of data on an artificial disc. The first artificial disc in Atlanta was implanted in 2008. That's only 13 years, 14 years ago. There's really no data beyond 10. So we don't know when that case is going to be revised. So as a life care planner, statistically, we're going to plan for an extension or revision after 10 years. And we're going to recommend a fusion. And a fusion doesn't have the best data. That's the reason why everybody in here should be, on their knees, being grateful for being a chiropractor, because our patients feel better. What we do is minimally invasive, and we can keep a patient, just like I did for 30 years, coming, over and over again with good chiropractic hygiene. We can keep them going indefinitely. And sometimes if they do have to have surgery on their lower back, and I've not been in practice for 12 years, I was in practice for 30. So we're talking about 43 years. Some of the patients I saw, 40 years ago are having spine surgery today. So as a chiropractor, we do the best we can. The medical providers do the best we can. But if you want to be successful in personal injury, the recipe is easy. Too many chiropractors are way too stubborn and feel that, hey, I can do it all. I don't need anybody else. My patients get better, and they pound their chest, and that's all well and good. But, sometimes if you want to be successful, you have to have a big enough throat to swallow your pride. And there's a lot of people that choke on it. So unless you can help the attorneys settle these cases for what they feel that they're worth, they're not going to use you. And the other thing that you have to realize is that attorneys make horrible doctors, and doctors make very bad attorneys. So when you take a look at the facet injuries and we talk about chronic pain and the treatment of chronic pain, I have attorneys that call me up and say, Steve, I don't want to use this doctor anymore because I'm looking at the MRI and he has 4 herniated discs in his cervical spine, and your neurosurgeon doesn't want to operate on him. He's way too conservative. And I said, wait a second, you're looking at the MRI? You're not looking at the MRI, you're looking at the MRI report. There's a big difference between the report and the actual scans. So I think one of the biggest problems we have in our industry today, if we want to call it the healthcare industry, is MRIs that are overread, MRIs that are way too robust. Nothing will kill a case or ruin your reputation more than sending a patient to an imaging center who gives overinflated reads. You cannot make a good case. You can structure or build a good case based upon the information. But if the case is not good from the beginning, the case will never be good, because the facts are the facts and the facts don't change. It's a matter of how the facts are organized, and if your records make sense and your records tell a story that is believable. Why did your patient wait 5 days to come in before she went to a doctor? Why